Hi, my name is Dr. Cozy, and I am the physician that is in charge of your care today. Really quickly, can I just have you verify for me your name and date of birth? Perfect, okay. So it looks like you were in an accident and you got a pretty good bump on the head. Is that correct? Sorry to hear that. When it happened, did you lose consciousness at all? Okay. Was there any kind of confusion, like maybe you didn't know what had happened, you didn't know where you were? Okay, but then it faded. Has it happened since? Okay, then it was probably shock, but we'll keep an eye on you. Any dizziness? How about ringing in your ears at all? Any lights in your vision? Any double vision? And are you having any pain anywhere else? Do you think maybe any other areas might be injured or? Okay. Was this your first head injury? Right. Any nausea, vomiting? And on a scale of 1 to 10, how would you rate your current pain level? Okay. Has that increased or decreased since the initial hit? Okay. And this says that you have an allergy to iodine. Is betadine okay? Okay. I haven't assessed your injuries just yet, but just in case we need to give you any kind of sutures, just want to make sure we're able to appropriately disinfect you. Are you taking any kind of blood thinners? Right. And do you have any kind of issues or history of issues with clotting? Right. One thing that can happen when people are in an accident is they can go into shock. Their adrenaline can block their awareness of pain, and there may be some memory lapses. If that wears off and you start feeling any kind of pain, discomfort, anything you weren't feeling before, please do not be shy and let me know right away, okay? First thing, I just want to take your temp. Oh, come on. There we go. I can just have you open your mouth for me. This is going to go right under your tongue. Great. And then close. Okay. Open, please. 98.3 Fahrenheit, you're in normal range. If you would, I'd like you to direct your gaze right here in between my eyebrows. Do your best to keep your eyes open, but if you need to blink, of course, that's okay. Don't move your head at all. Just follow my light, just using your eyes, please. All right. And while I have my pen light out, can I have you open your mouth for me? This is just going to press down on your tongue so I'm able to get a little bit of a better view. And I'm just going to check your airway. Make sure we don't see any kind of swelling. Alright, I'm going to remove my tongue depressor. Good. You can close your mouth. Now I'm going to take a look inside of your eyes just to rule out, swelling back there. So, again, try to keep your eyes open. And I apologize that I have to get kind of close here. But if there's any kind of fluid in your brain, we need to know. Not seeing anything. Right. Gonna have to kind of lean across you here. So forgive my reach. Just need to rule out any swelling inside of the ear or any kind of bleeding. And now I'm going to be palpating around your jaw, your neck, and shoulders. Okay, just making sure that I rule out any kind of injuries, any kind of jarring. Can I have you open your mouth for me real big? Like, okay, close. Open again. Close. And open one more time, please. And you can close. Temporal mandibular joint is intact. Any pain along the jaw? Okay. Pain. Okay. I'm gonna very slowly turn your head left to right or right to left. And I want you to tell me if you feel any pain, any kind of like catching. Okay. Just because we need to rule out any kind of disc herniation. It can happen, especially if you're hit from behind. Any pain? Okay. I'm gonna try one more time with just a little bit larger range of motion. Good. Okay. Any pain? Alright. Going to feel your shoulder here. I am feeling some muscle tightness. I'm not really feeling any kind of obvious injuries, but we're going to order some imaging of you, and I'm going to include your neck. Sometimes these injuries aren't obvious to us until later. You able to feel that? How about that? there. Okay. Good. Good. Okay. And good, all right. Gonna listen to your chest and check your tummy, and then we're gonna move on to taking a look at your head, okay? So can I have you take a deep breath in for me, please? And out. And again, deep breath. Again. And last one. Okay. Yeah, and you can breathe normally. I'm just going to listen to your tummy for a moment. Okay. Everything sounds good, but I did forget to ask you earlier. Do you know approximately when you last had anything to eat or drink? Okay. Just need to check just in case we need to take you back into surgery. You're going to feel me kind of pressing on you now, okay? Maybe more like a tap. They'll be pressing too. Let me know if you feel any tenderness anywhere. Alright. So now if it's okay with you, I'm going to remove your bandage, and I'm actually going to boost my stool just a little. So, okay. Don't worry. So my scissors have this little blunt edge, which keeps them from being able to cut you, okay? I just don't want to accidentally pull this if it is sticking to you in any way. If I cut it, it's gonna make it easier for me to be gentle. You do have a pretty good head lack there on your forehead. And that's going to need some sutures, my dear. I'm just going to stand up for a moment, okay? And just rule out any other injuries. I'll do my best to be gentle, okay? That the skin is broken. Definitely take note of that when we send you back to radiology. Okay. Bad. Not able to see anything other than that really deep cut we got right there. And because it is so deep, I'm going to irrigate it before we do anything else. So this is just normal saline. It should not sting at all, but you will feel a little bit of pressure, okay? It's really important that if there's any kind of dirt in there that we get it out before we suture things closed. We don't want you to have an infection. So I'm going to place this against your forehead, okay? Just like that. And you're going to feel a little bit of water or saline going to spray with a disinfectant. It has a bit of lidocaine in it, so it's going to numb you just a teeny bit. And then I'm going to numb you completely. But I don't, again, want to introduce any kind of bacteria, so we're going to start here. Should cover this part at least. Okay. So I am going to have to inject a bit of lidocaine because we don't want you feeling the sutures, okay? For the initial injection, you will feel it, and you will feel a bit of a burning sensation, though hopefully less strongly since we did apply the topical numbing. So if after the second injection you're still really feeling it, let me know, okay? Okay. Start. I know. Okay. How was that one? Just pressure. Good. Okay. That's what you should feel. But some people have a higher tolerance than others. Okay. So I'm going to give that a couple of moments to kick in. And while we wait, I'm going to do a few tests just to rule out any kind of changes. So again, focus your eyes right in between my eyebrows. Good. Okay. And let's have you follow my light again. And then we're going to do a bit of a different test. It's going to look like I'm going to poke you in the eye, and I promise you I won't. I'm just making sure that your blink reflex is intact. So try to continue directing your gaze right between my eyebrows. Okay. Good. Good. make sure that you're nice and numb. So, can you feel that? Good. How about there? There? Okay. Good. Feel that? Okay, good. Just gonna take a peek to see if there's any kind of debris that needs to be removed with the tweezer. That didn't flush out. But I'm not seeing any. So I'm gonna go back in one more time. Okay. Protect your eyes. Okay. Nice and saturated. So, make myself tall again. Okay, so the most you should feel is some pressure. If at any point you feel more than that, let me know. We will make sure to get you a lot more numb. But at this point, you should be pretty numb. So let's just test one more time. Did you feel that? How about there? Start. First one is done. think we're gonna do 4. All right. Halfway there. You are doing great. Last one. Going to apply some antibiotic ointment here. And we will be sending you home with samples so that you can apply this yourself. All right. is a lot easier to make smaller sizes fit without discomfort. So if we need to add more bandage, we will. But it looks like that's perfect. I'm not going to do too elaborate of a taping job because we're going to check this a few times while you're here. We want to make sure that you don't develop any kind of redness or swelling or drainage. I gave you 4 sutures. So when you're discharged, I will have a nurse come in here with some paperwork for you that will have instructions on how to take care of those sutures. But it is important that you keep it as clean and dry as possible. But you're still going to want to apply that antibiotic, so we want to make sure there's a good balance. We don't want the sutured area to dry out, but we also don't want it macerated. Both of those things can get, it can disrupt the healing process. So, a couple other things I want to do, and then I'm going to go and submit an order to radiology to have some scans done. First one is a hearing test, okay? So I'd like you to close your eyes and, not yet. Let's see. I have 2 tongue depressors here. I'm gonna make some sounds with them, like, okay. I want you to tell me when you hear them getting close to your ear, and also raise your hand for which side you hear. Okay. Now you may close your eyes. Good. 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 Okay. You can open your eyes. Hearing appears intact to me. And then I want to test your coordination. So I'm actually going to take off my gloves. Okay. So what I'd like you to do is touch your nose and then touch my finger, okay? Okay, so let's start. Nose, finger, good. Nose, good. Excellent. Okay, so let me just write up an order. So I'm going to go and send this off, okay? It shouldn't be too long until I bring you back, but I will have some nurses coming in here to check on you periodically until that happens. If you need anything in the meantime, there is a call button right there on the remote. Please don't hesitate to push it, okay? Okay. After I've spoken to the radiologist and reviewed your scans with them, I will come back in here and discuss with you what we've seen and any potential treatment plans that we come up with, okay? Okay. So I'm going to step out so I can go pass this off. Please, if you need anything, push that button, all right? Okay. I'll see you in a little bit.